Each of us was sent here to serve and protect our constituents. That's why Republicans voted unanimously against Obamacare in 2009, because we believed it was our job to stand up for middle-class families we were sent here to represent. Because we, and not just us, but countless healthcare professionals, policy experts, and citizens across the country saw this train wreck coming literally years ago. We knew the pain it would cause and warned against it. I wish the president and Washington Democrats had listened back then. I really do. I wish we'd been wrong about Obamacare too. But because the failings of this law are about so much more than a website, they're really about real people. Yes, healthcare.gov fiasco can be seen as almost comical at times, like a surreal parody of government bungling. But as the president says, this is about so much more than a website. He's right about that. The pain this law is causing is not digital, it's real. Workers first began to feel the pain when employers started cutting hours, and then benefits, and some jobs altogether. Spouses felt it when they lost their health coverage they'd had through their husband or wife's job. College graduates felt it when they could only find part-time work, if they could find anything at all in the Obama economy. And this was before basically anyone had even heard of this Obamacare website. Now that the healthcare law is actually coming online, many Americans are finding they'll be seeing premium increases, or that they'll be getting hit with higher co-pays and deductibles, or that they'll no longer see the doctors or use the hospitals of their choice. In fact, I've been hearing from constituents in Western Kentucky that a number of hospitals and healthcare providers they've relied upon will no longer be available in their network. And in many cases, they'll be responsible for 100% of the costs associated with services performed at those facilities they used to use. Let me repeat, 100% of the cost. How is that an improvement? How is that reform? Many in the middle class are also learning that the health plans they were promised they could keep are being taken away from them anyway. They feel absolutely betrayed, they feel hurt, and they feel vulnerable. When these folks are offered, quote, comparable plans at all, they're often completely unaffordable. And if they poke around on the exchanges, assuming they can even log on, many are finding that Obamacare coverage is going to cost them way too much, not offer them what they want, or both. Here's a note, for example, I recently received from a constituent in Caldwell County. This is what my constituent said. According to our health insurance provider, we can elect to stay on our current plan for this year with less coverage, or switch to affordable care plan that provides a little more coverage, but at a cost increase that's almost double. We currently pay $653 per month, and it would increase to over $1,100. After talking to the insurance company today, it seems I was lied to by the President and Congress when they were told that the Affordable Care Act would not require us to switch from our current insurance provider. My husband and I work hard, pay a lot of taxes, and ask for little from our government. Is it asking too much for the government to stay out of my health insurance? Now, her family's not alone. A CNN report this morning estimates that roughly one half of the 600,000 people in Kentucky's private insurance market will have their current insurance plans discontinued by the end of the year. This just isn't right, and it's certainly not fair. It's even more unfair when you consider that the administration chose to exempt businesses from this law for a year, but didn't think the middle class deserved the same treatment. Well, Republicans do. We think the middle class actually deserves a permanent exemption from this law. But as long as partisans in Washington continue to jealously defend Obamacare, well, we'll do at least whatever we can to fight for greater fairness for the middle class. I hope more Democrats will join us to make that happen, because a website can be fixed. But the pain this law is causing, higher premiums, cancel coverage, that's what's really important. And that's what Democrats need to work with us to address by starting completely over with true bipartisan health care reform. Mr. President, I yield the floor.